Our in-depth coverage continues on the fight for the lives of the most vulnerable, the unborn, and their brave mothers. Attorney, author, and the Cardinal Francis George Fellow at the Ethics and Public Policy Center and the Nicholas Center for Ethics and Culture, Mary FioRito, joins us now to delve further into this complex issue. Mary, it's great to have you back with us. Earlier in this program, we discussed the legal aspects of the abortion debate at the state level, with access to abortion and contraception at the top of the minds for many. But what is missing in this discussion is clear. Support for women. What leading topics should federal lawmakers be considering at this time, Mary?
Well, I think the very first thing they should do is to halt the disinformation and, frankly, the outright lies that are being perpetrated upon American women right now. Probably the most dangerous of these is that somehow laws that protect the unborn will make it difficult for women to receive treatment for ectopic pregnancies or miscarriage treatment. And that is just blatantly false. We have had Catholic hospitals and doctors come out saying that is not true. We have always treated women with ectopic pregnancies and women who are miscarrying. We can do that in a way that respects the lives of both the unborn child and his or her mother. Our duty is to care for both patients. We can do that safely and carefully. We know that Catholic hospitals have been doing this all along, so it's really disingenuous and dangerous for the federal government to be, allowing this kind of information to circulate, and in some cases, they're even promoting it. President Biden has talked about miscarriage treatment being in jeopardy. And the last thing we want is for a woman who is experiencing an ectopic pregnancy in particular, but also a miscarriage, to be afraid to go to the hospital because of Roe versus Wade being overturned.
Absolutely. It's
Again, Catholic hospitals treat women. Right. And that is what I'm truly concerned about, that women will be afraid. And we saw something very similar to this when the partial birth abortion debate was going on. I don't know if you remember that, Montse, but Planned Parenthood put out misinformation saying that the baby received so much anesthesia via the mother that the baby was actually dead at the time the procedure started. That was absolutely false. And it took finally for the head of the American Society of Anesthesiologists to come out and say, if we gave a mother that much anesthesia that it would kill her unborn child, it would also kill the mom. And they told stories of how women were coming to them and to other anesthesiologists absolutely terrified, putting off necessary surgery during pregnancy because of a Planned Parenthood lie, because they were afraid they would get the kind of anesthesia that kills the baby. So we've seen them do this before. It's incredibly reckless and incredibly, disrespectful of the medical profession, who has always been able to treat women with ectopic pregnancies and miscarriages. Happened before Roe. It's going to happen after Roe is gone.
And I know that has to be a priority for the pro-life movement and for the federal government. Let's talk about initiatives that help women, like the PUMP Act or the Nursing Mothers Act, that sought to expand workplace protections for nursing mothers. With formula shortages still affecting American families today, why aren't these initiatives getting more traction?
Yeah, and they really should. And I think, again, this is just because of the very divisive tone that we see coming out of the White House and from other, blue states and Democratic governors, where anything that is promoting women's health and well-being during pregnancy is somehow seen as a threat to abortion. It's really frightening that these kind of things that, actually benefit women and benefit their children. I mean, there's study after study after study that shows that children who nurse really do better across the board in terms of their immune systems and, other developmental milestones, that women who nurse have children who bond better, et cetera, et cetera. So to somehow undermine those efforts, again, it puts women at the service of the abortion industry and not the other way around, which is what it should be. But we can also look at other state initiatives. For example, in Texas, that now has a 6-week ban, they also have an incredible law called the Texas Alternatives to Abortion Act, which provides support for moms and their newborn children all the way up until the age of 3. And the Texas state legislature has put its money where its mouth is. They offer services that are really comprehensive wraparound services. And they do so with a huge influx of funding from the state, $100 million so far. And so they are really committed to making sure that women who are able to choose life also have the support that they need. And private charities like Catholic Charities are using their public support from their donors to even enhance those services all the way up until the time that the child is 5 and then starts kindergarten. So it
Wow.
really is. It's really very exemplary. And, I mean, you look here in Illinois where I live, we have elective abortion on demand, taxpayer funded, right up until the 9th month of pregnancy. But yet we rank, I think, 45th out of 50 states in terms of services to disabled. So what kind of message do we send to people with disabilities and to women who are living in poverty? That abortion is your best solution and will give you as many free abortions as you want. But, don't come and talk to us about wanting a safe school for your child or, other kinds of preschool care for your child. Those are very few and far between, but we are putting all of our resources into abortion, which sadly, many poor women feel forced into having. They don't want to have them across the board. Those, women of color and the poor tend to score much higher in terms of pro-life views and beliefs when they're asked about them, but yet they are the ones who are the most forced by economic circumstances to walk into an abortion clinic.
That's right. The lack of support is coercive. Absolutely. I want to ask you one last question, Mary, just because you know the pro-life movement and it's beginning so well. You talk about it all the time. How is the face of the pro-life movement changing with this new generation that calls itself the pro-life generation, but is very different in the way that they approach these issues?
Yeah, they have a very interesting approach. Some of the groups are really very much grounded in the consistent ethic of life. So they're very much pro-life on the abortion issue, but they also feel very strongly about issues like capital punishment and the environment. And they tend to weave those messages into any of the consistent ethic and, what they call whole life approach to the abortion issue. So they really are outspoken on a number of different things, but they believe in the name of human rights and consistency that they must include the unborn in that calculation of belonging. So they're very much about being inclusive and what they would call a radical inclusivity, where everyone gets included just by the fact that they're human, the disabled, people who are in marginalized groups. So it's a little different from the way the pro-life movement started, back in the late 60s and early 70s, where, from what I have been told from those who were in that first generation of pro-lifers, they were really convinced that once people saw ultrasound images, and once people understood the capacity of the unborn child to feel pain, for example, that the better angels would win out, and that Americans would say, wait a second, these really are small human beings, and we can't do things to harm them. But unfortunately, that message didn't resonate with everybody, and we had to kind of embrace some different strategies to be able to get to where we got with the Dobbs case. But we had science on our side, we had human rights on our side,
yes,
we had the truth on our side,
and science on our side. They won out. They absolutely won out. And I think Pope Francis made that point in his interview to Reuters, that science is definitely on our side, and it's about changing hearts and making abortion unthinkable. Mary, it's so wonderful to be with you, and we'll look forward to seeing what else you're doing to fight misinformation and to protect women. Thank you.
Thank you, Montse. It was a pleasure to be with you.